Hello, my name is Ayanna Powell. My partners are Bridget Bauer and Daphne Surratt. Our community oral health project is on toothbrush contamination and disinfection methods. Due to technical difficulties, Bridget was unable to record her portion of the project, so I will be voicing over what she said. Now, toothbrushes play a huge role in a person's oral health and overall health. Essentially, we use this device to remove plaque, soft debris, and other types of bacteria from the oral cavity. However, how effective could a toothbrush be if it's not properly cleaned before and after use? The overall purpose of our project is to basically study how proper disinfection is important when dealing with our everyday materials, such as a toothbrush. Toothbrush contamination is very common amongst families who share the same bathroom. The bathroom contains various types of fecal matter and bacterial strands in its environment. Since there is a common misconception amongst the community that simply rinsing a toothbrush with water will clean the toothbrush, we'll be testing different methods of disinfection, and the misconception raises awareness to the prevalence of periodontal disease, regardless of healthy oral habits or lack thereof. Our target group is to address the families in Fortis College who share the same bathroom and are unaware of the contamination risk factors, or even how to maintain a clean toothbrush. Now, as mentioned before, the toothbrush plays a huge role in removing plaque, soft debris, and other types of bacteria from the mouth. Now, if we're not constantly decontaminating the toothbrush, think about all the harmful bacteria that we're putting back into our mouths. This bacteria can actually result in gum disease, or otherwise known as periodontal disease. These links of periodontal disease can be linked to other systemic oral health issues. For example, diabetes and gum disease. Gum disease can accelerate the progression of full-blown diabetes and vice versa. Mouth bacteria. People with gum disease are more likely to experience heart attacks to those who don't have it. Stressed and depressed people are higher at risk for dental problems. Pregnancy. Pregnant women with gum disease are more likely to have small or premature babies. Now, adults without teeth are more likely to have chronic kidney disorders. And not to mention, anemic people are usually have sore or pale gums, and their tongue becomes swollen and smooth. This condition is also known as glossitis, by the way. These are just a few oral systemic links that can potentially be prevented with proper disinfection.
According to our literature review and in alliance with the research that we conducted, previous findings has shown testing that was done on those with healthy mouths, ranging from the ages of 6 to 30. Now, after just one use, it was proven that there was bacterial growth on the toothbrushes. That bacteria consisted of the Streptococcus bacteria and the periodontal pathogens. And both of those types of bacteria leads to gingivitis and periodontitis. Now, reiterating that this was after just one use, think about how much growth has occurred after multiple uses. And also keep in mind that this was done on healthy mouths. Moving on to our material and methods, we took 4 toothbrushes. The first toothbrush was infected with the cold virus. The second toothbrush was infected with the flu virus. The third toothbrush was infected with the strep throat bacteria. And the fourth toothbrush was taken straight from packaging, or in other words, it was a clean toothbrush. Next, we gathered 7 agar dishes filled with a solution of sugar, beef broth, and gelatin. Waited for the solution to harden, and then they were labeled for both contaminated and disinfected. We later smeared the toothbrushes in those dishes, and after each toothbrush was smeared accordingly, they were then covered and sealed. And after it being sealed, we then took the contaminated toothbrush and went about the disinfecting method. Our first toothbrush which had the cold virus, was disinfected with chlorhexidine. That chlorhexidine measured out for 4 ounces. The second toothbrush was disinfected with the white distilled vinegar, that white distilled vinegar being 4 ounces. And the third toothbrush was disinfected with hot tap water, that hot tap water being 4 ounces as well. And the fourth toothbrush, there was no need for any disinfecting method. We had already smeared that previously on our fourth quote-unquote contaminated agar dish. However, it was specifically labeled as clean toothbrush. Now, the reason that we chose those disinfecting methods was in order to have something that is available to the public and to rule out any common mistakes that people make. So each toothbrush sat in the disinfecting solution for 3 minutes. After disinfecting the toothbrushes, they were removed and dried on a clean paper towel. Then they were smeared on the new agar dishes, followed by being properly sealed. All the agar dishes were kept in a warm environment for about 3 days. After evaluation, the evidence showed that chlorhexidine provided the most decrease in bacteria, followed by the white distilled vinegar. The toothbrush disinfected with hot tap water showed no changes. This proves that the most common method of disinfecting, in fact, shows no disinfection at all. Now, given that chlorhexidine is prescribed at dental offices, it may not be available to all. However, white distilled vinegar is. In addition, if the white distilled vinegar is not readily accessible, an alcohol-based mouth rinse, for example Listerine, works at the same level. Some additional tips to maintain a clean toothbrush include using a barrier or a cap with holes. Remember, a wet environment can equal to accumulated bacteria. And also, along the same lines, lack of oxygen can lead to an accumulation with bacteria. Continuing on, be sure to store your toothbrush in a cabinet or a drawer. Remember to replace your toothbrush after 3 months, along with the cap, and after an illness such as a cold, a flu, a strep throat bacteria, or even in this case that we're dealing with, the coronavirus. Keep your toothbrush away from other toothbrushes. For example, one toothbrush can be stored on one side of the sink. Another toothbrush can be stored on the other side of the sink. The third toothbrush can be stored in a drawer. And that fourth toothbrush can be stored in the medicine cabinet. Do not, I repeat, do not share your toothbrush at all with anyone, regardless if you're related to the person, whether it's a friend of yours, whether it's your husband, that ties into relation, no matter what, your best friend, regardless, do not share your toothbrush with anyone because that bacteria is contagious. And in addition, you do not know what that other person has. Continuing on, be sure to keep your toilet seat closed after use to avoid the spread of droplets and aerosols. It was shown in previous studies that fecal matter aerosols have the possibility of spreading to 2 meters away. So by closing that toilet seat, you're helping to prevent any of that leakage out. And lastly, just a reminder, remember you can disinfect your toothbrush after every use with white distilled vinegar or an alcohol-based mouth rinse. As I just said, remember to disinfect after every use. However, going back to our previous findings, seeing that the clean toothbrush had the presence of some bacteria after just opening from the package, you want to remember to disinfect your toothbrush before and after use.
In conclusion, we would just like to acknowledge a few people who helped make this project possible for us, starting with Miss eBay, our community oral health instructor at Fortis College, Landover. She helped us get a few supplies so that we were able to conduct this experiment, and she also helped us formulate our research paper. We were ever so grateful for that. We would like to thank our classmates who put in the time to give us adequate feedback on our presentation overall and gave us ideas on what we should include in our project, and we are ever so grateful for that. We would also like to thank any families and friends who contributed to this project, whether it be resources or financial monetary donations. Thank you. We are ever so grateful.